My name is Larry. I live in Jarvis, Ontario, Canada. I worked in the steel mill for 34 years, where it was recorded that I was exposed to asbestos.
My name's Robert. I was exposed back when I was 17 to age 26. I worked at a lot of the refineries in Montreal. Shell, Imperial Oil, Kraft. So that's where I got exposed. First symptoms I had was chest pain, really, really bad chest pain. It was like shards of glass hitting me.
We were bike riding, and we normally could ride for kilometers, but this time I could barely make it a kilometer, and I had to stop. After the bike ride, I started noticing shortness of breath.
I was on a trip to BC actually, and we stopped in Sault Ste. Marie. I had some chest pain, it came back again, and I went into the Sault Ste. Marie Hospital, and their doctor insisted on doing x-rays, and he found a little tumor, cancer tumor.
I was referred to the SMART program through a doctor in Hamilton, and that's where I was diagnosed with having mesothelioma.
The SMART program at Toronto General, I was actually referred to that prior when I had the chest pain. Once they found out about my asbestos exposure over the years, they put me in the SMART program.
So Dr. Pleural brought me into his office and told me my options, and the one result was not palatable, so I went with the operation.
When I first went into Princess Margaret, my prospects weren't good. I got 6 to 18 months what I was given. I had 3 radiation treatments prior to surgery. They did a biopsy on the tumor that they found, and then they did another biopsy on the fluid in my pleura, and both were cancerous. So prior to surgery, they did radiation to kill all the cancer in the pleura fluid and the surrounding area. I had the surgery February 2nd, 2022.
I waited 6 months for my operation, and it was done in August of 2022.
They took the lining, the pleura, off the left side of my lung, and after that they found some more cancer on my diaphragm, so I had to take that out as well.
I had a major surgery done. They removed my right lung and the pleural lining around the perimeter of that lung. They also cut the 6th rib so they could have enough room to pull the lung out.
I was out of the hospital in 5 days. I had the surgery one day, the next day was quite a bit of pain with it, but they sent me home 5 days later. I was walking around doing laps in the hospital. I had no intention of staying there very long.
They were going to keep me in for 2 weeks, but I recovered so quickly. My oxygen levels came bouncing right back, and I could do the stress testing and the exercising that was minimum the requirement to leave and finish my recovery at home. Recovery is a slow, long process. It was months before I was able to actually function. I had to stay close to a washroom because I couldn't function very well. I wasn't really prepared for the recovery at home, but we got things in order.
It was a year before I had full mobility back again, where I could do whatever I wanted to do with some limitations, but it took a while. Within 6 months, actually, I was cutting the grass again.
I try to do as much as I can as far as getting out and about. My breathing is difficult at times, especially if I'm under duress or excess work. I do very light gardening work now, and we love to hike and try to live life just like it was before. My follow-up treatment was going to Toronto once a month for follow-up CT scans and blood work.
Follow-up treatments have just been scans. They're just checking to see if it's come back, and so far everything's clean. My health now is good. Cancer hasn't returned. I feel good. I'm still going for tests every 6 months.
My advice for anybody going through this procedure is to have a nice lazy boy available and have easy access to a washroom.
They can do amazing things nowadays. I had bladder cancer when I was 21 years old, malignant bladder cancer. They went in, they took it out. That's a long time ago. The stuff they can do nowadays, way above that.